In this section, we will discuss lung diseases. The big one that you're going to want to know for the board is cystic fibrosis, right? Affects 1 in every 2,500 Caucasian infants. The defect is found on chromosome 7. It's inherited as an autosomal recessive condition. The defective gene is the CFTR1 gene, which is the gene for the chloride channel. With this gene mutation, what you see is failure of the chloride channel and the resultant thick mucus secretions in the respiratory tract, in the sweat glands, and in the GI tract. So what does this cause? You get recurrent lung infections because of the lack of mucociliary elevator. You get bronchial obstruction and bronchiectasis as a result of those lung infections. One of the bad guys or pathogens that you want to associate here is Pseudomonas. Okay, so when you think CF, you've got to think about Pseudomonas respiratory tract infections. Patients also have reduced functions of pancreatic enzymes due to alteration of the GI-pH. So treatment is usually symptomatic here for recurrent pneumonias resulting from bronchiolar obstruction. Alpha-1 antitrypsin deficiency, this is when a person walks into your ER, they're 25, 30-year-old, and they look like they have the liver of a 40-year alcoholic and chronic smoker, right? So we're looking at alpha-1 antitrypsin protease inhibitor being the defective gene. Incidence varies from anywhere 1 in 800 to 1 in 2,500. It's autosomal recessive, okay? Failure to inactivate elastase is made by neutrophils in the lung, 2-point mutation alleles of alpha-1 antitrypsin, both S and Z, okay? So this is where the different incidence levels come in. 1 in 800 persons are SZ, that's 30% normal protease inhibitor activity, and 1 in 2,500 are ZZ, which is 10% normal protease inhibitor activity. Patients that have alpha-1 antitrypsin deficiency are at great risk for developing emphysema. Lung damage further compromises the elastase inhibitor. ZZ individuals are also at risk for liver disease, like I mentioned. Treatment for these people, very, very, very important to counsel them not to smoke. So just to kind of review here, as we go through and look at the different diseases that we've talked about, remember that for autosomal recessive, most of your metabolic disorders and steroid biosynthesis defects are autosomal recessive. You have to have both alleles knocked out because the other allele has an enzyme that can make up for it. The exceptions to this rule are the X-linked disorders, Lesch-Nyhan, Hunter's and Fabry's, and G6PD deficiency. Most hemoglobin disorders are autosomal recessive, the exception there being hemophilias, right, which are X-linked. ADA deficient SCID, complement deficiencies, those are autosomal recessive. Most other immunodeficiencies are X-linked. So you think about Bruton's agammaglobulinemia, you think about CGD, that kind of thing. Fragile X syndrome, Rett syndrome, muscular dystrophies, all X-linked disorders. Most triplet repeat disorders, Fragile X, Huntington's, you're going to think autosomal dominant. Most cancer predispositions, autosomal dominant. Most collagen mutations, again, autosomal dominant or dominant negative, right? Cystic fibrosis, autosomal recessive. That concludes this section of the lecture. Next, we will discuss diagnosis and therapy of genetic diseases.